Good morning, everybody. I wanted to come online and talk to you about a few points. These are completely my personal views. However, I hope it benefits all of you. A little bit about the current situation with the COVID-19 virus in India. As we know that our country has been in a lockdown for about 2 months now, and the number of cases are gradually increasing. In fact, the numbers are pretty scary right now. While most of the patients are asymptomatic, a few of them do land up in the hospital, and unfortunately, we have also lost some of them till now. A large number of healthcare workers, that is the doctors and nurses, have also been affected, about more than 550 in the whole country. But despite the numbers that are rising with the COVID-19 cases, there are also plenty of people and plenty of patients who are suffering with other diseases and ailments. As being a tropical country, we have plenty of vector-borne illnesses like malaria and dengue. Not far behind are the chronic diseases like diabetes, hypertension. Then we have the seasonal diseases like seasonal flu. Not to mention the mental health ailments like depression, anxiety, and the like. And these patients do need proper medical care. It's not always possible with telemedicine or an advice over the phone or the internet. So I'm Dr. Ranajay Bhaumik. I'm one of the postgraduate residents in North Bengal Medical College, Darjeeling. And I wanted to tell you a few points which you can keep in mind the next time you visit a doctor. Since it's inevitable that you might have to visit your physician or your doctor for the next time you fall ill. First of all, it's always wise to take an appointment from the doctor or his assistant. In this way, the doctor can allot you a specific time and place. And this way, you will not get your money or your precious time wasted. And if you are punctual with that timing, you will also avoid a crowd in the doctor's OPD or his chamber. Now, we all know that the government have asked to use masks. But while going to the doctor, it's a good idea to use your own bed sheet. So please carry along your own things like your own bed sheet. And if you could carry a long blunt spoon for the doctor so that he can use your personal belongings while he does your checkup. You may have plenty of reports, all reports like your blood sugar reports, your thyroid reports, your urine analysis reports. You may have an ECG, an echo, or maybe a CT or an MRI. Please take out these reports from the envelopes and arrange them according to the time that they were done. In this way, it's helpful for the doctor to make out how you've been improving over time. You may have plenty of old prescriptions with the same doctor or previous doctors if you've been having that illness for a long time. If this is the case, then please take out the newest prescription and put it the topmost. In this way, it's easier for the doctor to see what was prescribed the last time and what are the medications you are taking right now and how regularly you've been following it. When you visit the doctor, he may need a proper history from you. So please enlist in your mind the chief complaints that you want to tell the doctor. That is, what are the main complaints that got you to the visit in the hospital. How long you've been suffering with this illness, how this illness started, and how it's been progressing over time. If you've been suffering with other illnesses before or the same illness in the past. If you have other ailments apart from the disease that you're presenting with. If you have other problems like problems with addiction like smoking or the use of alcohol. If there are other members in your family or close relatives who may have a similar kind of illness. If you've had a recent history of travel outside the country or from other states. And apart from all these, if you feel that any kind of information is necessary for the doctor for his treatment and diagnosis, then please let him know. After you're done with the visit, try not to stay in the doctor's chamber for too long. In this way, you can avoid crowding too much at the doctor's place. If you have any questions which you may have regarding the prescription, regarding the drugs, then you can ask the doctor later, and hopefully the doctor and you can come up with a way or a technique to address this concern. While you are waiting for the doctor for the visit, you may find that there are plenty of papers, newspapers, journals, or magazines lying around. It's a good idea not to pick these up in an impulsive manner and just read them, because you never know if others might have touched it too. Please maintain proper silence and discipline while you wait for the doctor and even after the visit. It's probably a good idea to dress appropriately, wear loose clothing so that it's easier for the doctor to measure your blood pressure and check your other vitals. Apart from these, please remember the regular advice that have been regularly given by the government and other authorities: proper social distancing, regular hand washing with soap and water, the proper use of sanitizers regularly, and your general hygiene. I hope all of us, that is, we doctors and you, can come together and overcome this crisis. I wish you the very best of health, and hopefully we can see each other on the other side. Thank you so much.